Good morning, everyone. Good morning, everyone. Happy New Year. And to our Latino and Hispanic community members, happy Three Kings Day. I want to welcome all of you to the first all-school assembly of 2017. In a short while, sophomore Leanne Woolman will introduce our speaker, who has a profoundly powerful story and message to share with us. I had the good fortune to be introduced to Gary Mandel this past summer by fellow parent and board member Mark Woolman. And it was ironic, oftentimes I think we adults ask you, particularly as educators, we ask you all the time to step outside of your comfort zone, to grow and to challenge yourselves. But we adults, most of the time, we stay right in our comfort zone and in a place that we feel very comfortable. This summer, I, like Leanne, has took the Shatterproof challenge. We have a national crisis of addiction. I'm wearing a bracelet. It says 1 out of 3 actually is addicted in the United States. So it's a major issue. The Shatterproof challenge that I and Mr. Woolman and others did was to rappel down to Hartford Hilton. And even when you have a tight harness and a helmet on, there's nothing natural about when you're told, just lean back and start the ascent from 22 stories up. But sometimes you want to literally go over the edge to delve deeper into a very important subject matter, and that's what I decided to do. I'm very proud that KO has its own Shatterproof club. And Leanne Woolman is the leader of that, and what she's going to do, she's going to introduce our guest speaker for us. Once she's done the introduction, and this is a cue for you, Mark, we'll run the video, and then Mr. Mandel will tell us his story. So Leanne, thank you.
As Mr. Muscar said, I am Leanne Woolman, class of 2019. It gives me great pleasure to introduce today's assembly speaker, Mr. Gary Mandel. Mr. Mandel received his Bachelor of Science degree from Cornell University's School of Hotel Administration and his MBA with distinction from the Wharton School at the University of Pennsylvania. He is a former hotel executive, having been president of Starwood Lodging Trust and member of its board of trustees, and one of the founders and owners of HEI Hotels and Resorts. However, after losing his son into addiction in 2011, he left his hotel career and donated $5 million of his own money to launch Shatterproof, a nonprofit organization with the key mission of reducing the stigma and shame associated with addiction. Mr. Mandel wants to spare families of the tragedy his family suffered. Using a business model, Shatterproof looks to be all-encompassing, from influencing public policy to funding research into prevention, treatment, and recovery, to providing information and support for families. They are using innovative methods like the rappelling events to raise funds and bring awareness to Shatterproof and its mission. In 2014, I enthusiastically chose Shatterproof as my charity for my bar mitzvah cause, and I accepted the Shatterproof challenge to raise money and rappel down the 22-story Hartford Hilton. After rappelling for the first time when I was 13, I am proud to have continued on supporting this worthy cause by forming the KO Shatterproof Club with my brother Gabe, who now attends Cornell Hotel School following in Mr. Mandel's footsteps. When my brother and I started this club at KO, Mr. Mandel generously supported us with merchandise and ideas for the future of the club. With Mr. Mandel's support, we are looking forward to a very successful fundraising year with a culmination of the rappelling event that will be held on the 26th of July at the Hartford Hilton. Please help me extend a warm welcome to today's speaker, Mr. Gary Mandel.
Dear Brian, Dear Greg, from the moment you were born, you were the sweetest kid.
Michael, honey, you brought us such joy and happiness. Thank you for those 29 years.
Like every parent, my dream is for you to be healthy and happy and fully empowered to create the lives you really want.
I coached your Little League games for many years, and I always used to say, with the game on the line, I want the ball hit to Greg.
You were a natural leader, and so many people looked up to you. You were such an amazing person. What parent wouldn't be proud of that?
Just before entering high school, you tried marijuana for the first time with some of your friends.
It has been so difficult to watch you struggle with this devastating disease.
We know our family had a strong tendency for addiction. We all loved you so. You just needed more time to get well and really heal.
You were working hard to stay sober. Unfortunately, one night you made a bad decision, and that turned out to be fatal. You had been lifted into your car, driven to a local hospital, and then left in the parking lot. About an hour later, you were discovered, but it was too late. You had been left too long.
Since the moment when I first heard of your death, I agonized to make sense of it.
I worry that the world is not equipped to deal with the issues of addiction.
Ty, if we had the chance to do things over again, we would not let that stigma of addiction stand in our way.
Brian, losing you has shattered my life. However, at the same time, you have inspired me to make a promise. We are going to equip society to protect our children from developing the disease of addiction to alcohol and other drugs. Addiction needs a national commitment. Addiction needs a national voice.
We know your strength. Recovery is possible.
We are stronger than addiction.
Together, we can end addiction.
We are Shatterproof.
Together, we are Shatterproof. Please join us. Visit us at shatterproof.org.
Thank you. And good morning, everyone. I'm really pleased to be here because what I'd like to talk about, I think, is just so important for all of you to hear. I'm speaking so often in front of adults, and speaking in front of all of you at your age, which is really the future of our country, is just, it's an honor for me. There's a lot I'd like to tell you about addiction, and there'll be time afterward for questions and answers, which I hope you'll take advantage of. But I think what I'd like to do is begin with a story. And the story takes place in 2004, 12 years ago. That year, two boys were in high school in Easton, Connecticut, a small town near Fairfield, Westport, where I was raising my family. And both boys were growing up. One of the boys, Mikey, was diagnosed with cancer. As you'd expect, his family was easily able to access the highest quality medical care. Medical care that was all based on scientific research. His parents told their friends about their son's disease. And as you'd expect, our town rallied behind Mikey and his family. Parents came to their home with cooked meals. They asked if they could drive carpools. Kids in middle school held bake sales for Mikey on the weekends for his local charity, raising money for kids with cancer. And the whole time Mikey was sick, he received all the love and compassion that anyone with a disease could ever ask for. In fact, deserves. Well, 2 streets away, my son Brian was also struggling with a disease. But for Brian and our family, it was totally different. We looked for medical care for our son, for his disease. But we couldn't find any medical care for Brian for his disease that was based on medical research. It just didn't exist. We didn't tell a lot of our friends about Brian's disease. And our community didn't rally behind us. No one came to our home with cooked meals, no carpools. And when Brian came home to visit, no bake sales. And to be honest, I didn't tell a lot of people because I was embarrassed. I felt like a failure as a father. How could I raise my son with this disease? What was wrong with me? Well, the disease my son struggled with was addiction. It was very different. A little bit more about Brian. From the time Brian was born, he was the son I'd always dreamt of. Always smiling, always hugging me. My little buddy. He used to love playing with little trucks in his room for hours, or running around the backyard chasing butterflies. And as a young kid, he did all the things that young kids do. And as he grew into a teenager, he did many of the things that teenagers do, including trying pot. But for Brian, that's where things changed. Unlike many others who experiment, Brian became addicted. And for the next 8 years, things escalated, which it does very often. He became addicted to pot. And from there, it was a series of treatment programs, 8 different treatment programs over 8 years, as his use escalated into harder and harder drugs. And as I think back on those years, there were so many really very difficult times, but a lot of wonderful times. There were many times that Brian wouldn't listen, and they were tough. But there were times that Brian would get into a treatment program, and it would take hold, and he would just have such a wonderful attitude. Be there with that big smile all the time. I remember once visiting him in a treatment program in Florida. And I got up early, I walked into his room, and there he was, he had his treatment book open. And he was studying away. He looked up at that big smile of his as I walked in the room. He said, "Dad, I'm getting this. I'm gonna beat this." But addiction always doesn't work that way. On October 20th, 2011, I was woken up in the middle of the night by my cell phone ring. My son Brian had died. He was 25 years old, and he hadn't used a substance in 13 months. And even more tragic, it wasn't just addiction that took my son's life. It was the feeling of shame that he had every morning when he opened his eyes. A feeling like an outcast to society that caused him to wake up that morning. And the history on his laptop shows he researched suicide notes and then wrote a note of his own, lit a candle, and took his own life. Alone, without any family around him. And ever since that day, I've continually asked myself the same question. If both boys had a disease, why are these stories so vastly different? Science tells us that addiction is a disease like any other. Its causes are genetic, biological, environmental. But so many in our society disagree. They say those with this disease have a character flaw, weak willpower, and they and their families are isolated, judged, and stigmatized. And so many of them who need the help the most don't get it. The answer to my question, why are these stories so different? Because Mikey was treated like a patient, and Brian, an outcast. Well, 2 weeks after Brian died, my wife came into our bedroom and found me crying on the bed. I thanked her because she had framed a serenity prayer, placed it on my nightstand. I told her the only thing that was keeping me alive was reading that first sentence over and over again. God, grant me the serenity to accept the things I cannot change. It kept me alive reading that sentence. But as the weeks and months went on, I started looking at the second sentence. The courage to change the things we can't. And I started really focusing on the fact, as I learned more about this, it wasn't just about Brian and I. When Brian was alive, I read a lot about addiction, but it was always about how to help Brian. It was very narrow focused. Now I was reading how to help others, and I was struck by 5 facts. Number 1, how big this disease was. I had no idea. If you had asked me when Brian was alive how many fathers in my town of Easton, of 6,000 people, had a son who was addicted, I would have raised my hand and said, me and a few others. But I don't even know who the few others are because no one talks about it. Everyone's ashamed. But I found out it wasn't me and a few others. That there's 25 million people in this country with a substance use disorder. 25 million. That's 1 in 10 above the age of 12. That means 1/4 of American families, 1/4, have someone in their family addicted, mother, father, son, or daughter. I learned that the day Brian died, 350 others died the same day. But it's not talked about. What if 350 dolphins washed ashore in Maine? It'd be a nightly news for a week. This was 350 people dying every day and wasn't being talked about, unless it was a celebrity. The 3rd largest cause of death in the country, behind heart and cancer. And now the number is close to 400 a day. It's been growing dramatically. Second thing I learned was my vision of addiction was Brian and the people I met through him when Brian was addicted in his late teens and 20s. That was my vision. Or my vision was someone pulling up to me when I was in New York City and wanting to wash my windshield and he had a brown bag. Or some poor kid in a back alley shooting himself with a needle. But no, I learned that's not addiction. I read research reports and found out that 8 out of 10 of those addicted today, 80%, became addicted before their 18th birthday. And this is so relevant to all of you. 80% before their 18th birthday. And I thought about it, and that was Brian. Yeah, I experienced it in his late teens and 20s. But yeah, he probably became addicted when he was 15 or 16. And the reason is, and this is so important for all of you, the reason is your brain is not, the human brain is not fully developed until your early to mid 20s. It's just biological, it's not fully developed. And it is so susceptible to becoming addicted. You take someone at age 21 who tries a substance for the first time, they are 4% likely to become addicted, 1 in 20. You take someone who's 14 who tries a substance for the first time, they're 30% likely to become addicted, almost 1 in 3. And it's linear, 4% to 30%, and it goes by age. So the earlier you start, based on the development of your brain, the likelihood of that substance connecting with you in a way where you become chemically addicted and you can't stop, out of your control, rises dramatically. So one of the messages I can leave here with you today, it's not harmful to drink when you're 25. It's just not. As long as you do it within moderation. But you have a beer or a glass of wine at age 14 or 15, I can tell you thousands of stories of someone said, I had one beer at age 14 or 15 or 16, And I was off to the races and I couldn't stop. Just connected me with in a way chemically that I could not stop. And it's out of the control of the person. It's just how it works. So that was number 2, children. 1, the size of this issue, the number of people. Number 2, it's children. The third thing that struck me, and this ripped my insides out, I learned that there's this whole body of knowledge, $20 billion worth of research that's been done in the last 2 decades. Research for that's proven programs that you can put into schools, put into communities, put into our healthcare system that have proven throughout any doubt, evidence-based scientific research, programs that you can put in our communities that will significantly reduce the number of our teens, whoever use substances and whoever become addicted. Yet most of this, not all of this knowledge is sitting in research journals, and very little of it is being implemented. And another body of knowledge you can use for treatment. Again, all in research journals, very little being implemented. I read about programs that if I'd only known about as a father, could have saved Brian's life, and hundreds of thousands like him, if parents knew about it, and it wasn't being implemented. Which led me to 4 and 5. How could this be? How could you have a disease that is so widespread, 3rd largest prevalence behind heart and cancer, affecting our children? And we have information today that can start saving lives tomorrow, and it wasn't being used. The first reason was shame and stigma. Because shame and stigma, doctors don't want to treat it. It's the bad kids. I don't want to talk about it. It's people who are addicted, don't want to tell their parents or don't want to tell their doctor or don't want to go into treatment because they're afraid of their family, their friends, or their coworkers finding out. Shame and stigma, there's $1 billion worth of research done a year, $7 billion for cancer. Even though twice as many people in this country are addicted than those have cancer, and it's 3 times the cost to our society. If there's $7 billion in cancer research, it should be $15 billion for addiction, but only $1 billion, all because of shame and stigma. And then it hit me. There's American Cancer Society, American Heart Association, Autism Speaks, MS Society, Susan Komen for breast cancer. There was nothing for addiction, no such organization. And what do these organizations do? They raise hundreds of millions of dollars a year. They fund private research. They advocate for change. They get research budgets increased by our federal government and our local governments. They get laws changed both federally and locally. They end shame and stigma relative to their disease. They get information out to families, and they provide support for families. And no such organization existed from addiction. So looking at these things, I remember it was the last day of March, 5 months after Brian had died. I was sitting at my desk in my office, thinking that this was going to be a small local charity. And I looked at these 5 things on a sheet of paper. And I looked up on the wall, and there was the last picture of Brian alive that I had framed. I had taken the picture 5 weeks before he died. It was on his 1-year anniversary of being substance-free. And we had played golf that day, and we were riding our bikes to dinner. And we were chatting away. And I looked to my right, and he was gone. And I looked back, and there he was on the street helping someone. And I'd snapped the picture. I didn't know at the time the significance of the picture, but it became the last picture of Brian ever alive, and it's framed on my wall. Personally, I'm not that religious, but at that moment I looked at these 5 things on a sheet of paper, and I looked up at a picture of Brian helping somebody, and something took over my body and said, this is what you're going to go do. And after discussing it with my wife that night, I came in the next morning and promoted top CFO of our company to run my hotel business. And I set out on a path to create the American Cancer Society for Addiction. It seems crazy, but if I can impart a second lesson to all of you, it only takes one person to start something. And the one person can't do anything. It's about engaging people. And I set on a path to do that. I spent the next year and a half creating a business plan. I didn't rush. I flew around the country for the next year, meeting all the best researchers in prevention and treatment, and hired consultants. And together we developed a business plan. Probably a third lesson is I could have spent the next 10 years learning and making that business plan perfect. But business plans are only as good as the piece of paper they're written on. You need to go in and do it. And you learn. There's no business plan that was ever written that you followed exactly. You get enough so you know to start something, and then you mold along the way. So I thought I had enough knowledge. I pulled everything in that I knew. I shrunk it all down to a business plan that was actionable, and we launched our organization. A few years later, it's only been a few years, as I stand here today, yes, I'm distraught. The holidays were tough for me. And every day is hard. But in a lot of ways, I feel blessed. A lot of ways. We've built this organization around the country, and I've met such wonderful people who just warm my heart every day as they get involved. We have almost 100,000 people involved in the organization now in a variety of ways, as donors, volunteers, work with us, advocates, helping change laws all across the country. We've been more successful than I could have ever imagined getting laws changed around the country. There are a variety of laws that you can change in states that will absolutely reduce the number of people who will ever die of an overdose. And if anyone would like to know more about them, feel free to ask it in the Q&A. But there's 4, 5, 6 laws you can work on, and we've got now laws passed in 10 different states in the last 2.5 years, and we're working now on 4 others as we speak. One of the things we've also been very successful with is that promise we talked about earlier of ending that unjust shame and stigma, that no one should feel if they have this disease. No one should feel if they have a disease, any disease. And one of the ways that we've done that and raised money to do our advocacy work, as we talked about earlier, was rappelling off of buildings. It's not just rappelling off a building. It's engaging people in a community to come together with big banners and a message that addiction is a disease, should not be stigmatized. And why rappelling? There's breast cancer walks and walks for cancer and autism. Why rappelling? We wanted something to signify we're in crisis right now. We wanted to bring immediate attention to what we're doing. And the way to do that is through something unique. And rappelling off a building seemed like a good way to do that. And there's a nice metaphor with people with addiction. The hardest step about recovery is the first step. And then you go step by step, always looking at the sky, with your friends and family down below clapping and cheering until your feet safely hit the ground. The Woolman family has been extremely generous and supportive of us here in Hartford. We rappel off their building in Hartford every year. It's been one of our better events around the country. We've held 47 of these around the country in the last 2.5 years. But 3 of them have been in Hartford at the Woolman's Hilton Hotel. And for those who've been there, what you'll see is people coming together to engage in a cause, to change the dialogue about addiction, and to raise funding for our advocacy work. Before I finish, I'd like to show you a short video about what these rappelling events look like, because again, it's not just rappelling.
There are 25 million Americans in this country actively addicted to alcohol and other drugs, which is 1 in 10 above the age of 12.
One hand on the rope to hold the rope straight. The other hand, I'm going for is something that needs to be brought out into the open, because it could be you, or it could be your child, it could be your mother, it could be your father. No family is safe from it.
Well, my son suffers from addiction, and if he had cancer or asthma, people would be understanding.
The general public still feels that addiction is a lack of willpower or that you're a bad person, and we're here to shatter that myth.
Something like this brings so much awareness to the disease, and when people start talking about it, I think it helps people get treatment.
As we repel, Americans will watch people unite on behalf of those with addiction.
An event like this helps bring that awareness and gives people the courage to say, I'm not alone.
We are coming together to increase awareness and funding for the prevention, treatment, and recovery of this disease.
Well, the reason I'm here is addiction's touched my family as well.
I'm repelling from my son Paul, a close family friend who passed away.
To support my son is an addict.
I'm repelling from my sister-in-law.
I'm repelling from my dad.
Once and for all, we will end the silence, shame, and stigma.
And this is something big, something huge that's going to bring it out and get people the help that they need and give them the courage to move forward.
Go Shatterproof! Go Shatterproof!
Go Shatterproof! Go Shatterproof!
We are Shatterproof. This is our promise to America.
Go Shatterproof!
So a little bit more about what we've accomplished in the last year and where we're heading. In addition to getting laws passed in 10 states, holding 45 of these events around the country, we just relaunched our website about 6 weeks ago. And it now fulfills a vision that was identified in our business plan in 2012. Because up until our website launched 6 weeks ago, if you had someone in your family you think may have autism, you can go to autismspeaks.org and you can learn how to diagnose that person. You have a family member that just got diagnosed with heart disease, you can go to AmericanHeart.org and learn everything you know about evidence-based treatment and recovery. But until 6 weeks ago, there was no such site for addiction. Ours was a good starter site, but it hadn't provided a lot of good information yet. But our new website does, and it's only a start. But now, someone has a family member who's struggling with addiction, they can go to our website and there's enough there to walk them through the entire process, all footnoted, all evidence-based. You're raising children and you want to learn how to prevent it from happening. We have good information there. And it's only a start. It'll be twice as good a year from now. But we now have something that is a place for parents to go. We were very active with the CDC last year. The CDC, I think you'll all find this interesting. Addiction's been here for years and growing for years, but there's a huge spike going around this country of people dying of an overdose of an opioid. An opioid is Vicodin, Percocet, Oxycontin, or heroin. Vicodin, Percocet, Oxycontin are no different than heroin in a pill. It's the exact same drug in a pill. It's prescribed in a lower dose for people with pain. And up until 15 years ago, doctors rarely prescribed Vicodin, Percocet, or Oxycontin because they were taught in medical school it's dangerous. It could be addictive. People can overdose. People can die. And doctors only prescribed it in limited circumstances. Acute pain, like a broken arm or surgery for 2 or 3 days. Or cancer care. Or end of life. That's it. Well, that changed 15 years ago. 20 years ago. In 1995, the FDA approved not a quick release oxycodone, which is quick release in 2 hours, but a slow release oxycodone over 12 hours called Oxycontin, which you've all heard of. And then Purdue Pharma spent hundreds of millions of dollars convincing the entire healthcare industry that these pills, because they're slow release over 12 hours, not quick release over 2, are not addictive. And now we can start treating this for every ache and pain, every sore back, every tennis elbow, every sore wrist, every headache. We should give them to everybody because they're not addictive. They're 12-hour release. And so the healthcare industry believed it. And the amount of pills being prescribed on an annual basis went up 4 times in the last 15 years. From about 60 million prescriptions a year to 240 million prescriptions a year. 240 million prescriptions last year of opioids. There's 250 million adults in this country. Almost one prescription for every adult in this country. 4 times increase in pills, almost a 6 times increase in number of people dying from an overdose. It went from 6,000 a year to 2015, 33,000 people a year died from an overdose of a prescription pill or heroin. And by the way, we keep hearing about heroin. This is not a heroin problem, this is a prescription pill problem. Of those 33,000 deaths, about 20,000 were prescription pills and 13,000 were heroin. But of the 13,000 in heroin, almost all of them started with prescription pills, became addicted, and went to heroin because it was cheaper and more available. So don't think, I guess a third lesson here, or a fourth lesson, that because prescription pills are prescription, they're safe. They are not safe. Well, another thing that we were able to accomplish last year is the CDC saw this rising epidemic. And they spent all of 2015 pulling together all the best research in the country. And that research indicated clearly that Purdue Pharma was wrong, that these pills are addictive and they should not be used for more than, they should be very rarely used the way they were years ago. And when used, only for 3 days at a time, not 30-day prescriptions like probably half of you have gotten here for a tooth being pulled. 3 days should be plenty if you even need it for 3 days. What happens is doctors are prescribing 30 days, someone takes 1 or 2 pills, someone may become addicted or not, but then they go into the parents' medicine cabinet, and that's where kids get it on a Saturday night. Because they think it's safe, because it's a prescription, but it's not. And that's what's happening across our country. So the CDC came up with a set of guidelines for doctors of when to prescribe and when not. They were due to be released in January, a year ago. The week before Christmas, big article in the New York and all the papers across the country. CDC guidelines derailed indefinitely, not coming out. Next day, big article in the Associated Press. Pharmaceutical industry lobbying efforts destroy guidelines, end them, not to be released. So we jumped in partnership with the CDC and ran a campaign. We got op-eds issued in editorials around the country. We had our advocates, people all across the country, families who care about this issue, teens like yourself who care about this issue, calling their legislators, getting their voices heard, posting comments on the CDC website in favor, hundreds and hundreds of comments, almost 1,000 comments we had issued in favor of the guidelines, why we need them. And we won the guideline, and 10 of us went down and testified at a hearing in Atlanta. And we won. The guidelines were issued 2.5 months later. And the guidelines are now out in this country. Because a lot of our work, and a lot of the work of people in this room who repelled last year, who gave us the money to do so, and the voice to do so. In closing, I'd like to say that I often think of the last time that Brian came home. It was 4 months before he died, and he had a great visit home, and we had family barbecue that day, and everyone had a great time. And after everyone went home, Brian and I were sitting on the back porch talking about our favorite topic. I know you're up in Hartford here, so maybe it's not yours, but we were talking about Eli Manning and the Giants. And you're probably Patriot fans up here. And then the conversation turned to his recovery. He looked at me and he said, "Dad, someday people will realize I'm not a bad person. I just have a bad disease, and I'm trying my absolute hardest. Well, the someday that Brian spoke about has been way too far off into the future. Because in the few minutes that I've been up here now, 6 others have died in the United States alone, just while I've been up here, related to addiction. And you know what I wonder? I wonder the simple things. What were their names? When they were little kids, did they used to play peekaboo with their parents the way Brian used to do with me? So for the sake of those 6 people, and all those others who have died or are struggling today in shame and stigma, together, all of us, we can join together and end the stigma of addiction, end the shame and isolation that's so unjust, that Brian wished for. And we can prevent others from becoming addicted by delaying our use into our early 20s, and so many other things, and helping others who may be struggling with this. We can make all of us, our families, our loved ones, shatterproof. Thank you.
Open up the Q&A period. If you could just come down to the mic. If you have a question or a comment, that'd be great.
Hi. You said earlier in your talk that you saw different research journals with treatment for addiction. What was one of them that stood out, in your opinion?
Sure. What's your first name?
Zachary.
Zachary, thanks. So the question relates to treatment. Here's a perfect example. For those, when Brian went to 8 different treatment programs, the treatment industry in the United States for addiction started in the 1930s. It was started by 2 middle-aged white men who were addicted to alcohol. And I suspect you've heard of AA. And they started AA. These 2 middle-aged white men who were addicted to alcohol formed a group, club. And it grew to like, 10 or 12 men, and they get together every morning at 8 o'clock in the morning. And they would talk about how they were feeling about getting those urges to drink alcohol and what it felt like. And they would all share their feelings, and it would last about an hour. And then they would agree, okay, we got 23 hours to go. We just can't take a drink for 23 hours. And they would get themselves 23 hours without having a drink, hopefully. And they would meet again. And then from that grew the 12 steps, which you may have heard about. And it's all based on abstinence. It's based on you can't touch a substance. Your brain is too physically connected to it. And that's been the treatment, the mode of treatment in this country literally since the 1930s. Abstinence and AA in 12 steps. And it's worked for a lot of people, millions of people, millions. But the good news is in the last 20 years, there's been research done. I mentioned that $1 billion worth of research. And for people who are addicted to opioids or alcohol, there are now medications which improve the probability of success in straight abstinence. Abstinence works, but this makes your probability of success even better. And those medications are in medical journals, and very few people know about them. So for my son, who was addicted to opioids, there's a medication called Suboxone, which the first 7 treatment programs that Brian was in, the first 4, Brian was not addicted to opiates. It was marijuana at that time and Xanax. But the last 4 he was, no one ever mentioned anything. The 3 of the last 4, no one mentioned anything about medications. The last program he was in, they did mention this medication for someone addicted to opioids. And they put him on it. He was there for 2 months, he was doing great. And then he got out, and the first outpatient program he went to, they immediately took him off it, saying, there's no research to back this up. And I wasn't aware of the medical journals. It's not out there for the public. And that's a perfect example.
Thank you.
Sure. Thanks.
Okay, so first, thank you for the speech. That was really beautiful.
Sure.
And so, as you know, marijuana has been legalized in a few states, not only for medical but for recreational purposes.
Right.
Do you think that this will remove stigma against drug users, or?
That's a great question. Your first name?
Charlie.
Charlie. Thanks. Excellent question. Everybody heard Charlie's question? So, there's a lot of issues surrounding marijuana. Charlie's question specifically was about, would it reduce stigma to drug users because of the legalization of marijuana? The answer is, for people smoking marijuana, this movement across the country of legalization, both for medical and recreational purposes, absolutely will reduce the stigma of it. But it's a very harmful thing what's going on here. Research shows, and the research is very common sense, intuitive, that as anyone feels less risk in something, use goes up. So let's just take someone in this room who's 15 years old who has been convinced, educated by their parents, and educated themselves, and they don't want to smoke marijuana until their early 20s. They know that smoking marijuana at below age early 20s is very harmful to a developing brain, and even if they never become addicted, the chance of psychosis, loss of IQ points, all kinds of bad things can happen smoking pot in your teens. And let's say you're educated to that and you believe that, and you're not going to try pot. Now you just read in the paper that marijuana just got legalized in a bordering state, Massachusetts. Anyone, any 15-year-old, and any 59-year-old, your perception of risk just went down. Well, if they legalize it in Massachusetts, it can't be that bad. All this stuff I thought about developing brain probably isn't true. Your probability of using just went up. It went from almost 0 in that first example to, if I'm at a party, some kids are doing it, it's probably not that bad. Especially if you have a beer and now someone's smoking pot, they just legalized it in Massachusetts, can't be that bad. That is a really bad effect of this legalization effort. Is perception of risk goes down, use is going up, and there's no question the data is out, use is going up in the states and the bordering states where pot is being legalized. That's a bad result of this.
Okay, thank you.
Sure. Your first name?
Grant.
Grant, nice to meet you.
Why do you think families are shy about telling others that their family member is addicted?
It's a great question, especially for someone of your age. I could tell you how I was, and I suspect for most people, because it's not viewed as a disease, it's viewed as a bad kid doing bad things. And, Brian was a bad kid, right? 10 kids went out into the backyard and tried a beer for the first time when they were 13 or 14. And maybe one starts to become addicted, and maybe that one starts using pot. Maybe that one moves to Xanax or prescription pills. And all of a sudden, it's the bad kid. If that kid had cancer, it would be, we're rooting for him. As a parent, you wouldn't feel embarrassed like my son has cancer. Like, my son got cancer and he's got a disease, and everyone would be rooting for me and my family. But you have that kid who became addicted, it's like, what did I do wrong as a father? Why is my kid acting out? Why is my kid falling asleep in class at school? Why is my kid, his grades going down? I feel bad, like I did something wrong. And I feel as a bad parent. Even though in my particular case I have 4 other children, they're all doing well, I feel like a failure as a parent. That's why. And also, even worse, the person with the disease feels horrible. I can't imagine that there's an addicted person in the United States, in this world, on the planet Earth, that wants to wake up and use drugs. That wakes up in the morning and says, I'm going to disappoint my parents today. It's going to be a great day. I'm going to disappoint my siblings today, my brother and sister. It's going to be a great day. No, what happens is their brain's telling them to use. They use, and instantly they start hating themselves. Why did I do that? I shouldn't have done that. What's wrong with me? Why can't I stop? I'm so stupid. I couldn't resist. No, your brain's as much as I'm breathing air, your brain's telling you to use it. That's why.
Thank you.
Thanks. Great question.
So my name's Ethan.
Ethan, thank you.
This is more a you question.
Sure.
Was this hard the first time that you've talked to like schools or to actually come up and tell other people to stop when it's about your life and how your son died? Is that hard for you?
Ethan, these are all just amazing questions. Really good questions, so thank you. Yes, it's, look, the reality is I'm sad. I'm always going to be sad. I live with it every moment. And doing this also, in many respects, hurts. But it also feels really good. It feels really good when I'm looking out, talking, and I can connect with people's eyes, and I know they're listening and learning. And it feels really good knowing when I drive home today, if there are 10 of you in this room, if there's one of you in this room today that may have smoked pot at 15 and now will wait until you're 19, 20, or may never. Well, Brian would love that. And, I had a meeting at the White House about 6 weeks ago. And just before the meeting, we're all ready to sit down in this meeting, and a woman comes up to me and she said, "Are you Gary Mendel?" I said, "Yeah." And she said, "My name's Teresa. I'm from Kentucky. And 4 months ago, I walked into my son's bedroom and found him lying on the bed, on the ground, lying on the floor, and he wasn't breathing. I immediately called 911. First to arrive was a policeman. She said, because of the law that you passed in my state last year, the policemen were trained and they had naloxone with them, which is a medication, which they administered to him, and he immediately woke up. He lived, only because of the law that you passed." She took out a picture of him smiling. Then she hugged me and we cried. It makes it all worth it. Great question.
Thank you so much.
Thank you. Thank you.
Can you describe the legal work that your foundation does?
Sure. And your first name again?
Adam.
Adam. So Adam asked about the legal work. It's really advocacy work, changing laws that we're doing. So there's several laws that you can pass in states that will reduce the number of people who can die from an overdose. The first one is a Good Samaritan law. So, sorry, is it Adam?
Yeah.
Adam and I are in college. We're in a room, or we're in our mid-20s, doesn't matter. We're in a room, and we're popping pills illegally and drinking whiskey. I drop to the ground. I'm not breathing. Is Adam going to call for an ambulance? Well, if he was doing the same thing that I was, and he's afraid of getting arrested, he's not going to call. He'll put a blanket on me, and he'll probably say, I think he'll be okay. He'll wake up. And that's what he'll really believe. Alternatively, if his state has passed a law called the Good Samaritan Act, a 911 Good Samaritan Act, which says that if someone has stopped breathing and you make a phone call, the person lying on the ground and the person making the phone call cannot be arrested, many more people will obviously call for an ambulance. So we've got that law passed in 6 states right now. So that's one of the laws. Second law is, I mentioned that medication. Well, actually, in Kentucky, we passed both those laws. So in Kentucky with this woman, Teresa, we passed a Good Samaritan law. She would have called anyway whether it was her son, because it was her son. But the second thing is that medication I mentioned, naloxone. Naloxone is a medication that has been around since the 1970s, but hardly ever used because not that many people were dying from an overdose. If you stop breathing and you take it within an hour or so, it goes right to your brain, goes right to your opiate receptors, knocks out the opiate, which has caused you to stop breathing, and you start breathing again, and you live. But unless you pass laws, it's not used. And you would say, why does a medication need to have a law to have it used? Well, because doctors don't want to prescribe it, they're afraid of getting sued. A big part of the law is to be able to prescribe it not to just a patient, but friends around them. So let's just say that you have a sibling or you have a parent, easily could have a parent or anybody you know who's addicted to heroin or Oxycontin, and they've gone to a treatment program and they're doing well, and they're not using. But just in case, just like a bee stings kit, anybody can relapse, just like with diabetes. That whole family should have it in their medicine cabinet. The school, you should have kits here in the school. It should be in every dorm rooms. It should be everywhere, like defibrillators for heart. So to have them everywhere, not just with a patient, you need to pass a law. You need to pass a law to have ambulance drivers have the ability to administer them on site, the way they did for Teresa's son, versus put him in an ambulance, take him to the hospital where he or she may die along the way. So that's the second law. The third law is prescriber education, doctors. Any doctor who is in their 40s and up has taken almost no education, maybe an hour or two, some none, a medical education about prescribing of pain medication when they were in medical school. So we passed a law in Connecticut a year and a half ago. One of the components of the law was to be licensed to prescribe medications in the state of Connecticut. Every 3 years, you have to take a course in the proper prescribing of pain medication. Fourth one, big one. Every state, except for one, Missouri, has a prescription drug monitoring program. It's a database of what every pharmacy in that state has dispensed of medications to people who've been in that pharmacy. And it all rolls up to a central database. Although every state has one, doctors rarely check it. So what's the value of checking it? Let's just say that I go to a doctor today in the state of Connecticut. Well, let's just say I went to a doctor 2 years ago before we passed the law in the state of Connecticut, because we also passed this law in Connecticut. You go to a doctor 2 years ago in the state of Connecticut, I sprained my back playing golf, can you give me 20 Vicodin? Well, if a doctor checks the database, he will find a few things. He may find a few things. He may find, I haven't had no doctor in the state of Connecticut has dispensed, or neighboring states, because it all feeds into the database, has dispensed Vicodin, Percocet, or Oxycontin to me in the last 5 years. Well, then fine. If I really need it, follow those guidelines the CDC distributed, and you should have read and learned, and follow the guidelines. But what if he looks in the database and says, wait a minute, you got 20 Vicodin from a different doctor across the street last week? Then the doctor could say, wait a minute, you got 20 pills across the street, you want 20 more pills today from me? What's going on here? You're obviously doctor shopping. You maybe because you're trying to sell them, I can't give you more, or maybe because you're addicted. Let's get you into treatment. Let's find out what's going on here. Or the doctor may find out, let's just say some of you in this room have anxiety, and you're properly taking Xanax, properly, from a psychiatrist. Then you hurt yourself. Then let's say you go off to college, and you hurt yourself playing soccer. You go into the clinic, and your knee is really got banged up playing soccer or lacrosse. Doctor, without checking, gives you Vicodin. Maybe just 3 days, maybe it's okay, but gives you Vicodin. Well, the combination of Xanax and any of these pills we've been talking about can be lethal. And unless a doctor checks, they're not going to know. So that's the fourth law. And there's several others, but those are the four we've been working on.
Thank you.
Sure. Hi.
Hello. How do you think we as a society can start to erase the shame that surrounds addiction?
Great question. Your first name?
Laura.
These are fantastic questions, by the way, by everyone. a variety of ways. One of the ways that have been used in the past with other diseases like HIV/AIDS is everyone telling their stories. If there were 10 of you in this room who had a family member, or if there were some of those in you, if there's somebody in this, if there are people out there that are doing well in recovery, who are bankers, lawyers, factory workers, anything, carpenters, saying, yes, I'm addicted. Here's the face of addiction. I'm successful. I'm a teacher. I'm a plumber. I'm an executive. I'm this. I have 3 kids. I'm living a happy life. I'm not some bad person. I have a disease like diabetes, heart disease, cancer, and addiction. And I'm doing well with it. That's one way. Second way, another way is how we're doing with these events around the country, these repelling events. I mean, for those of you who've been at our Hartford event, they're tremendous. You get 130 people, 130, 140, 50 people rappelling down a building with 200 or 300 people at the bottom of the building with the TV anchors there, showing it on TV all day long in Hartford. With the anchors on TV saying, here's people coming out for a disease. Not coming out for bad people, stick them in jail. Or, we don't want to talk to them. No. There's events around this country every single day for diabetes, for heart disease, for cancer, for autism. Now there's events for addiction. Bringing people together for addiction is one of the other ways. And we're looking at other ways that we're going to start exploring next year. I guess another way also is, I've talked about this being a brain disease. One of the ways we're exploring, but it costs money like everything, but we're trying to find a budget to do it, is at our events, have some type of experience where people can actually feel sensory-wise what it's like for someone addicted. Either they walk through a bubble and they feel like they're in a brain, they can see exactly what's going on, or we're not sure yet, but we're exploring some way for people to better understand what it means to be a disease versus just simply saying, it's a brain disease. Just try harder. You have a brain disease, fine. Just try harder not to use. Well, if people can picture what's going on in the brain, it might be easier for them to be empathetic with someone with a disease. Fantastic question.
Thank you.
And I guess just to add to that, Shatterproof clubs all across the country. Because there are clubs for heart disease, cancer, and all other things. Create a club and spread the word. Today with social media, all of you in the room here have the power to change something a lot better than I do. All of you, that question, I challenge all of you to think of something that you can do here in this school to end the shame and stigma of addiction. And not just in a way that it does it in the school. I challenge you to think of something that will turn viral, that will spread across to 44,000 high schools in the United States, to get kids to speak up to end the shame and stigma of addiction. That's the challenge I have for all of you. It's that question, because you all know better than I do. So thank you. Thank you.